You get a cut, a scrape, even a tiny paper cut, and without you even thinking about it, your body just kicks into gear. It launches this incredible, totally automatic repair process. It's really like a biological construction project of the highest order. So let's open up this amazing repair manual and see exactly how our body rebuilds itself from the ground up.
Right? We slap a bandage on it, maybe wince a little, and then we pretty much forget about it. But that's just where the story begins. The second the bleeding stops, this amazingly complex and coordinated series of events gets underway. So what is really going on under that bandage? Well, this whole healing journey, it basically breaks down into 3 main phases. First, you've got inflammation. That's the emergency response. Then comes proliferation, which is all about rebuilding. And finally, remodeling. And get this, look at that timeline. This last phase can go on for months, sometimes even longer than a year. The whole thing is a much bigger journey than most of us ever realize.
Okay, let's dive into phase 1, inflammation. The best way to think about this is like emergency site prep for our construction project. The first responders are on the scene, and their first job is to control all the damage and get the area cleared out for the real building work that's about to start.
And what's so cool is just how specialized this cleanup crew is. First up, you've got platelets. They just swarm the area to form a plug and stop the bleeding. Right after that, neutrophils. Think of them as your body's microscopic soldiers. They rush in to fight off any bacteria or other invaders. And then, about 2 days later, the heavy-duty cleaners show up. These are the macrophages, and their job is to just gobble up all the debris, dead cells, and general mess. So that scab, that initial clot, it's doing way more than just stopping the bleed. I mean, yeah, it's a protective barrier, which is super important, but it's also acting as a temporary scaffold. It's the framework that all the new tissue is going to be built on in the next phase. All right, the site is prepped and clean. Now we are moving into phase 2, the proliferative phase. This is where the real construction starts. The emergency is over, the foundation is set, and it is time to rebuild, literally from the ground up. And this phase is just a flurry of activity. You have these specialized construction cells called fibroblasts that show up and start laying down something called granulation tissue. This includes a kind of quick and dirty version of collagen, type 3, just to get a temporary structure in place fast. At the exact same time, new blood vessels are being built, the wound is literally being pulled smaller, and that original clot starts to dissolve as this fresh new tissue takes its place. And this brings us to one of the most critical parts of the whole project, angiogenesis. I mean, think about it. Any big construction site needs utilities, right? Power, water. In our body, that means a blood supply. So angiogenesis is just the body's incredible way of installing new plumbing to get vital oxygen and nutrients to all those hardworking cells at the wound site. So how does the body know where to put all this new plumbing? Well, it uses chemical messengers, or growth factors. Think of these guys as the foremen on the job site. Factors with these fancy names like FGF and VEG, they're the ones giving the orders, telling the cells exactly where to build those new blood vessels. They're absolutely essential for a successful rebuild. But just like any construction project, things can get delayed. What happens if the supply chain breaks down? This is where your diet comes in, believe it or not. If your body doesn't have enough raw materials, things like vitamin C or copper, this whole rebuilding phase can just grind to a halt. It's a pretty powerful reminder of how what we eat impacts everything our body does. Okay, the basic structure is up. Now we get to the final and the longest phase, remodeling. This is all about taking that temporary fix and turning it into a strong, permanent structure. It's about upgrading all the materials for long-term strength. And the main event in this phase is what you could call the great collagen switch. Remember that fast, kind of weak type 3 collagen that was put down in phase 2? Well, now it gets systematically broken down and replaced with type 1 collagen. Type 1 is the stuff that's in your skin and bones. It is way stronger and much better organized. This is what gives the final scar its real strength.
Now, to make that big switch happen, the body needs a demolition crew. So it sends in these special enzymes called collagenases to break down and haul away that old, weak type 3 collagen. And just like our builders needed vitamin C, this demo crew needs zinc to do its job. If you don't have enough zinc, this whole critical remodeling process can stall out.
But here is a fascinating reality check. After all of this incredible work, the cleanup, the rebuilding, the remodeling, the new scar tissue never, ever fully regains the strength of the original skin. At its absolute best, it'll reach about 70 to 80% of its original tensile strength. It's a fantastic repair job, for sure, but it's not a perfect replacement.
So what happens when the construction project doesn't go exactly according to the blueprint? Sometimes the chemical signals can get a little overenthusiastic. And that's what leads to the kinds of scars that we can actually see and feel. Let's take a look at what happens when the healing process goes a little off script. One of the main culprits here is a growth factor we've already met, TGF-beta. It's crucial for healing, but when you have too much of it, it's like a foreman who just won't stop yelling, keep building, more collagen, long after the job should be done. And that overproduction is a primary cause of problem scars. And this usually leads to two main types of overactive scars. This chart lays it out perfectly. A hypertrophic scar, on the left, is basically an overproduction of that weaker type 3 collagen, so it's raised but it stays neatly within the borders of the original wound. A keloid scar, though, that's a whole different ballgame. It's got both types of collagen, it's totally disorganized, and, most importantly, it grows beyond the original wound borders, almost like little claws. Keloids are also way more likely to come back and are more common in people with darker skin tones. So you see, the body's repair manual is written for one thing, survival. It prioritizes closing a wound fast over making it look perfect. The scar is really a testament to that incredible instinct. But it leaves us with this final, really fascinating question. As we understand this whole process better and better, could we one day learn to rewrite the instructions? To tell the body not just to repair, but to perfectly regenerate?